I'm Dr. Kelly Grott. I'm an interventional pain management physician, and I work for Franciscan Physician Network. So you've got degenerative disc changes on your MRI. What does that mean? Degeneration of the spine is very common and happens as we age. It's normal wear and tear of the spine. In fact, up to 50% of 30-year-olds will have degeneration of their discs noted on their MRIs, and this number goes up to 100% by the time we reach our late 60s and early 70s. But what does that mean? You get a lumbar MRI and it says that you have disc degeneration. Does that mean that's what's causing your pain? Not necessarily. So sometimes we see these changes on our MRI and it's not necessarily causing any symptoms. Just like you can get wrinkles on your face and not have headaches, you can have degeneration of your spine and not have back pain. If this degeneration gets so bad that it causes, for example, disc herniations or impingement on the nerves as they exit the spine or the nerves within the spinal canal themselves, then that certainly can be causing your low back pain, as well as pain that's going down the legs called radiating pain. I would treat this with what's called a lumbar epidural steroid injection, in which I take a needle through your back and I coat the spinal cord in steroids to try to calm down some of that inflammation. Degeneration of the spine doesn't only happen in the discs. It can happen elsewhere as well. It can happen in the ligaments, it can happen in the bones themselves, it can happen in the joints that line the back of the spine called the facet joints. Each of these would require different treatment options, but there are many different treatment options that we can use to address your pain. For example, the little joints of the back of the spine called the facet joints can get arthritis in them, can have degeneration. When that happens, we can get something called osteophytes on them, which is extra bony outgrowths on the joint itself. That can also cause impingement on the nerve, or it can just cause pain in the joint, just like you can get pain in the joint from arthritis in your knees or pain in the joint from arthritis in your shoulders. That really causes low back pain that doesn't go down the legs, just really a band-like pattern across the low back, dull, achy pain. I would address the facet joints and the nerves that supply the facet joints, treating them through something called a rhizotomy or an RFA procedure, where we actually burn the nerves that supply sensation to those joints. Degeneration of the bones of the spine can result in something called modic changes. That basically means there is edema or swelling and inflammation within the bone itself. You can get wear and tear in the bone of the spine, and this could cause low back pain. There's a new treatment available that addresses this type of low back pain, and that is called basivertebral nerve ablation. The basivertebral nerve supplies the sensation to both the bone, the end plate of the bone, as well as the disc, and that sends pain signals up to the brain. So we go into the bone and we ablate that nerve, or we burn that nerve. When that nerve is burned, then it's no longer sending the pain signal to the brain. The good news is that although it can be very frustrating to go through all of these conservative measures, including physical therapy and over-the-counter medications, and not gain relief, there is still hope. If you see a pain management physician, a lot of times we will have a good option to treat your chronic pain, including low back pain. So don't give up hope. Seek care at a pain management physician.